In general, treatment options for COPD are medications delivered by an inhaled route. There are three classes of medications that are generally used to treat COPD. They are long-acting beta agonists, long-acting antimuscarinic agents, and inhaled steroids. Long-acting beta agonists are medications that are used to open up the airways and make it easier for patients to breathe. Long-acting antimuscarinic agents are medications that will reduce the amount of secretions in the airway and have also been shown to prevent the number of exacerbations and hospitalizations from COPD. Inhaled steroids are used to also reduce the amount of inflammation in the airways. In addition to all these inhaled therapies, for patients who have severe COPD and are found to have low oxygen levels, one of the best therapies for these patients is to go on supplemental oxygen. Oxygen therapy is indicated in patients with severe COPD who are found to have low oxygen levels, either at rest, with exercise, or at night. Oxygen levels can be measured in an individual by placing what's called a pulse oximeter on their finger. This oxygen meter registers how saturated someone's blood is with oxygen. One common misconception patients have is that if they need oxygen, they don't want to use it because of the fear that they're going to become dependent on this. This is not true. There are no addictive properties to oxygen. Patients can stop it at any time. It is true that patients with low oxygen levels will feel better and have more energy once they start using it.